Hi, my name is John Bosworth. I'm a licensed mental health counselor in St. Pete, Florida. I'd like to speak about the methadone effects on a fetus or an unborn child. Children and unborn fetuses are usually way more sensitive to any type of drug, whether it's legal, prescription, over-the-counter, whatever. A fetus or an unborn child is way more sensitive to the effect of the drug in the system. And if we look at it from a purely pragmatic perspective, an unborn fetus or a developing child, the development is not yet complete. So any kind of adverse effect that would happen in the adult from the drug would actually be much more detrimental to a developing fetus. And let me give you an example. If methadone, which acts on the central nervous system to produce depressed respiratory effects, if there is an unborn fetus or if a mother is carrying a child, that respiratory system is not fully developed yet, especially if it's in the first few months of the pregnancy. What happens is normal development is stunted, and that respiratory system will not develop as it should, or according to plan, so to speak. So what happens is there's two major birth defects associated with methadone when taken during a pregnancy. And the first one is intrauterine growth retardation syndrome, which means that the basically kind of sums up what I was talking about before. The uterus does not, the fetus does not develop properly in the uterus because there's too much of the substance, and in this case it's methadone. And also there's a lot of neurobehavioral dysfunction associated with methadone use in a pregnant mother. What happens also with any other drug, we start to see that there's low birth weight, small head size. So in effect, it really just it adversely affects the development of the fetus. And we're not sure specifically how it does it, and research doesn't really allow us to specifically pinpoint the differences between what the side effects would be in a fetus with methadone or what it might be with alcohol, because most people that abuse substances don't just abuse one substance, so it'd be very hard to kind of tease out the different effects of the different drugs. But safe to say that any drug, illegal, legal, over-the-counter, whatever, is not really safe to take. We're not sure of the effects that it would have on an unborn child. My name's John Bosworth, and I'm talking about methadone effects on a fetus.